Hi, my name is Sherry Harlan, program host for Reid Beside You. And welcome. And today our first guest is Dr. Jason Castleman. Welcome.
Thank you for having me.
And you are new to our Reid family.
Yes, I am. I'm fairly new. I started a few years ago, 2016.
And your specialty is allergy?
Allergy and immunology, correct.
Great. And what exactly does an allergist, and when would I go see an allergist?
That's a good question. So allergies in general and hay fever and allergic conditions are actually relatively common. About 50 million people actually worldwide suffer with allergies. So it's a common affliction that people have, and sometimes they're pretty mild and less severe and can be dealt with with over-the-counter medications or family doctors and things like that. For more severe cases and for cases that require maybe a little bit more care, more aggressive management, then I think that would be the situation where you could potentially see an allergist, and we'll sort of talk about what we do and what we can help with.
And so when does a lot of times people understand when you see an allergist, you have a lot of tests. And so give me an example. What type of testing is done by an allergist?
Yeah, I think it's there's maybe some misconception as far as what we do and that it's very scary and there's a lot of needles and things like that. It's really not. The first thing that we're going to do is we're just going to have a discussion and sort of talk about your history, what your symptoms present like, how long you've suffered, that type of thing. And then if we eventually move on to doing some testing, then there's different options as far as that goes, different type of testing that we perform in the office. Some examples of that would be skin prick testing, which is done for our seasonal allergies and our food allergies and potentially even drug allergies. It's a very simple procedure where the antigen or allergen of concern is basically scratched on the skin, either on the arm or on the back. And 15 minutes later, the skin will potentially turn red and itchy, and we can interpret different allergies that way. So that's one form of testing. We do that at any age. We can do it from newborns all the way up to the elderly. So there's really very little risk associated with that.
And those tests are pretty minimal as at the time that it takes.
Yeah, it really.
Or how long do you have to wait for results?
Correct. Yeah, once we put it on, it only takes about 15 minutes, and then I'll come back in with my nurse and interpret the testing, whether it be positive or negative, and then we'll come up with sort of with a treatment plan based on what we find on the testing. Great.
And just in a lot of news articles, and then dealing with, I know in different schools, a lot of people have food allergies.
Yeah.
And we read a lot about that. So what's some of the testing for food allergies?
Well, food allergies are not common, I wouldn't say, but they're becoming more prevalent over time. About 1 to 2% of the population suffer from food allergies. And they're sort of creeping up in the news nowadays as becoming more prevalent. So the testing is very similar to what we do with actually pollens in cats and dogs and dust and seasonal type allergens. So it's little scratches on the skin. We usually direct the food testing based on history. For example, a peanut allergy causing hives or swelling or something more severe, we could potentially test peanut for that patient. And then it's about the same, 15 minutes, and then we'll come back and interpret. There's also testing that is through the blood that we could do as well, in addition, if we need to solidify our diagnosis and confirm the true allergy exists.
And what about the patch testing? Is that?
Yeah, so patch testing is a little bit different. That would be more for a diagnosis of skin allergies. Okay. So certain people, believe it or not, can have rashes to things that are coming into contact with their skin. And whether that be personal care products or shampoos or soaps, conditioners, even fragrances and clothing, where they develop rashes over time. And we can do patch testing, which is a very simple procedure where we put different chemicals on the back, and we confirm true allergy exists for that patient based on that type of test. A little bit different than what we do for seasonal allergies in foods.
Is there an age limit on that the patch testing?
There isn't. No, we can do it at any age. It's extremely safe. Basically, the concept is we're putting the chemical on the back, It is a delayed response, so that would require the patient to come back 2 days later.
Okay.
Unlike the pollens and the foods and things like that. So we remove the patch. We look at the skin and interpret the test, and then we actually have them back for one more visit because sometimes it is a delayed response. And what's nice about that is if you can identify the things to which the patient is allergic, then we could potentially remove those from the environment, and the skin hopefully will clear up.
Another area we see a lot of is asthma.
Correct.
So what kind of asthma testing?
Yeah, asthma is very common. Many different forms of asthma. We know asthma is much more complicated than what we once thought it was. We do asthma management at Reid Allergy. We have what's called a spirometer, which is a device where we have patients forcefully exhale and inhale, and we measure numbers that could potentially look for different lung disorders, including asthma. And we objectify these findings and put it with the patient's clinical history and what they're feeling, and come up with a treatment regimen based on that.
Okay. And what are the types of problems that allergists manage?
Yeah.
Aside from all the other things that we
we mentioned sort of a few. So the common ones would be like hay fever, allergic rhinitis, it's called, which is basically congestion, sneezing, itching, runny nose from seasonal allergies and even perennial allergens like cats, dogs, and dust and things like that.
So because we've had a delayed spring this year, so we're probably about a month behind on where we normally are in those seasonal allergies.
Believe it or not, yeah, the tree and grass pollen are out. They are at a low level. You wouldn't believe it because there was snow on the ground recently, but they are out, and I think it's going to be a pretty rough spring. But to some degree, I think you're right.
So everyone listen to that.
Yeah, I think
expect a rough spring.
I think it's going to hit you all at once, type of thing. But we may be a few weeks delayed.
Are there some things that we can do to try to be prepared?
Sure. I mean, there's certain over-the-counter medicines that you can try as a first-line treatment. Unfortunately, a lot of these for our more severe patients just aren't quite enough, which is where my role comes in. And that way we can talk about different options that are prescription options, or even doing some testing to identify some of the things that we can avoid potentially in the environment as well.
So in addition to that, with asthma, what are some of the most common complaints that people with asthma have? Yeah,
people with asthma are going to complain of shortness of breath, chest tightness, wheezing, coughing at times, different allergy triggers potentially, different environmental triggers, exercise, cold weather, infections, sometimes it's worse at night, that type of thing. So all kinds of different categories of asthma, and we kind of can tease that out with our visits.
Another thing is with dermatitis. I know, do you see a lot of patients that need to be consulted on dermatitis?
Yeah, I see a lot of skin issues in my clinic. Some of them being in my realm, which is the allergic realm, with potentially, like I mentioned, contact dermatitis or contact allergies. I also see a lot of eczema and hives and things like that. And if it's anything that I don't necessarily think is within my realm that I can handle, then I can certainly get the patient to where they need to be. There's a dermatologist right in our office, actually.
I know, being in our hospital setting, we try to make sure that we are very aware of different fragrances and what to wear. So is there something you could express to the community that they can be mindful?
Oh, sure, yeah.
Because that does trigger.
It does, and I'm always cautious of that. As soon as I knew I was going to be an allergist, my cologne days were long over, that's for sure. But yeah, I think if you're in the hospital or healthcare setting, it's always best to try to avoid things that are really smelly and could potentially set off patients with underlying asthma or with skin issues as well and allergy issues, because it's best to be fragrance-free if you can help it.
And one of the other things is, what happens if people, one of the biggest things, if they're penicillin resistant, or what's some of the
issues with penicillin?
They can handle?
Yeah, I see some penicillin allergy patients and a lot of different medication allergy patients, and penicillin is the type of medication that is very easily tested. So believe it or not, folks that, that are allergic to penicillin or have been many years ago, many times lose that allergy, so to speak. So we can test them. Right around 90% of people that are thought to be penicillin allergic can actually tolerate penicillin later on in life. So if we test them in my clinic and we perform an in-office challenge to penicillin, many times we can get penicillin back off their medication allergy list. And this opens up a whole category of antibiotics for patients that many times have multiple antibiotic allergies.
And one of the more rare conditions, the anaphylaxis.
Yeah, yeah. So that's a less common issue that I see. Anaphylaxis can be to many different types of things. It can be to food allergies, it can be to venoms, it can be to medications. So that's a category of patients that is sometimes very scary, to deal with.
Because that causes like the loss of breath, or
it can cause
swelling.
Many very life-threatening, even potentially symptoms: throat closure, swelling, shortness of breath, loss of blood pressure, even loss of consciousness and passing out. So, if that occurs, then it's our job in the clinic to sort of try to figure out why it happened. If there was a trigger, to identify it, do the testing we need to try to make sure it doesn't happen again.
Great. And those tests, when you're doing those tests, that tries to make sure that, like you said, that doesn't happen again.
Correct.
So where's the best? And you are located in our brand spanking new building.
That's
that we
right.
have.
Right on Chester Boulevard.
Right at Chester and Waterfall Road.
Right.
So
Reid ENT.
So the building says ENT on one side and...
Correct, yeah, so the allergy side is on the right side as soon as you pull in, and you'll see, our allergy and hearing center, and we're together on the right side.
And you are accepting new patients?
Absolutely, yep. We'd love to have everyone is welcome, all ages.
And we'll have information where our community can contact you.
Yep.
And we want to thank you for being on Reid Beside You today. Thank you, Dr. Kesselman.
And thanks for having me.
Thank you. And we'll be right back.
Life can sometimes be chaotic. And with small children, it can be difficult to get to the doctor.
Hi, Mrs. Towns. How are you doing?
I have a sick little boy right here. I think he might have an ear infection.
With Reid Health Now virtual visits, you don't even need to leave your home.
I'll send in a prescription for him.
Quick, easy, convenient.
I don't want to take the kids out today.
Oh, hey, Doc.
Reid Health, right beside you, right now.
Welcome back. Our guest for this session of the show is Heather Hart with Reid Home Medical Equipment and Jill Cisco with Dasco Home Medical Equipment. So welcome. And probably the first thing we need to know, people have seen the Reid Dasco trucks driving around in the community, as well as when they come to the hospital, they see the home medical equipment office on the main floor. So how did we develop the Reid partnership?
Yeah, I can answer that, Sherry. So Dasco has been taking care of patients for over 30 years, and we really truly focus on partnering with hospitals. We feel that our values are aligned, and really just making sure that patients are receiving quality care. So really, that's kind of how it all started. We have other partnerships with other locations, and when we identified the Reid values, we just really saw where we were truly aligned and wanted to work with them just more personally.
Great. And Jill, how long have you been with Dasco?
I've been with Dasco. This is my 7th year.
Great.
But our partnership was formed just in January of 2017.
And Heather, you've been a longtime Reid employee.
Yes, actually this year is my 10th year at Reid Health. I started in 2008 actually at the old Reid location, working for home medical equipment, and worked for 9 years in the store and in the billing office.
Great, and I know people might have seen you along with your children and doing various community activities, so we are very pleased to have both of you here. So explain to us what is home medical equipment, and then we'll figure out the differences as to what's home medical durable equipment, home medical equipment, I guess the first thing we'll say, what's the difference, and then what does the location at the hospital offer, and what does Dasco out in the community offer?
Durable medical equipment is, in essence, it's equipment and supplies that are durable. Physicians will write orders for things such as wound supplies or oxygen or CPAP. So they will write a prescription for it because it is covered by third-party payers. And they can bring it to us, and we can determine what's the proper equipment they should receive, and help them understand and educate them on the equipment.
And what would we receive from the Dasco side?
Yeah, from Dasco, our focus is more on the respiratory product. So as Heather mentioned, the oxygen. We also provide CPAP, BiPAP therapy, for patients with obstructive sleep apnea. But we're focused, I believe, more on the respiratory, and then home medical equipment as far as hospital beds, wheelchairs, things that patients would need to be in the home care setting.
And you often work together, I'm sure.
Definitely.
Yeah.
If someone brings me a prescription for a CPAP, I can call Dasco and let them know that I've got a patient that needs this product, and I can send them some information, and then they take care of it.
Because I recently was hospitalized, and then upon release, I needed to get a breathing treatment machine.
Nebulizer.
So thank you.
Yeah.
And because it was during the time it was 10 below, then I had the prescription, but someone had explained to me, and I worked at the hospital. So a lot of times, just for the community, it's just an education to realize that for the actual equipment, the prescription was serviced through Dasco. And then the actual medicine I received from the pharmacy.
Right.
So that was an education for myself. So,
So some of the things that we provide at our store, compression, hose, socks, garments, anything from thigh high, even arm sleeves. And we even can go a little bit on the custom side of that as well. So people that don't fit into that ready to wear off the counter.
And you have you're carrying some new items, such as some over-the-counter meds?
We took some of the top selling from our pharmacy downstairs, and we're providing them in our store. So it's a more accessible location than having to go down to the lower level.
And I know we're talking about more of the home medical equipment, but it's probably one of the biggest selling items that the community is aware of, that the hospital side has. Do you still have diapers?
We do. We still have diapers, and we have batteries.
Okay. So it's amazing that I didn't know when I first started to work at the hospital, I'd see all these people with these huge boxes coming in and out, and didn't realize how important that was. So a lot of people really depend on for the diapers. So I didn't want people to think that you no longer have them.
No, but it is still there. Diapers, batteries, and diabetic shoes.
That's great. And from a respiratory area, explain to me some of what the other things that you have.
Well, the biggies are, just as I mentioned, Sherry, we're focused on really getting those patients out from the hospital to home quickly. We're challenged anymore with how many days patients get to stay in the hospital. So we work really closely with the case managers, the respiratory staff at the hospital. We actually have a liaison too that is housed inside the hospital. And she helps as well with those discharges. But our big focus really truly is the respiratory oxygen, providing non-invasive ventilation. So this is a unit for chronic respiratory failure for those patients who are really severe with their breathing and need that additional support. It's a unit that is proven to reduce hospital readmits. So hospitals anymore are penalized when patients are readmitted back into the hospital. And that really, financially can hurt the hospital. So really our biggest focus is that respiratory, kind of the nebulizer as well, as what you mentioned. And then your beds and wheelchairs.
And I just want to highlight that, that it's pretty much a full circle when we're with the respiratory, that not only are you're actually not physically at the hospital, but you have people located at the hospital, and that's very important. I think the community needs to understand that. When you said I do want to mention that the clinical liaison is Debbie.
Yes,
Debbie Jones, that many of the people in our community have probably already met Debbie. So
yeah, she just kind of really eases the the fear of patients going home needing oxygen that have never been on it before. She'll go into the room and just really discuss what to expect when they get home. So she does a phenomenal job.
And she's worked with the community for a long time within the HME area, so that makes it a lot easier. I also wanted to focus on the actual Dasco Reid location. You're downtown?
Yes, we are in the middle of all of the construction going on.
Too, so they're not crowded into that small location.
Yeah,
and you're
on
next
campus.
door to RP&L.
Yep.
The customer service office. So.
Yeah.
And across the street from Esmond's.
Okay.
That's my other two. Those are my
There
two
you go.
go-tos.
Correct. The places how people can find it. So what's some of the other things that are located in that store?
Well, we actually have our manager that is there. Are you referring to people?
Are people or the other equipment or other supplies there?
Yeah, and everything there. We don't really have a lot of in-house. That's all been kind of taken over by the home medical within the hospital. But we're focused on those larger items. So those items are just in our warehouse, where our delivery technicians will come every day, have a set schedule to deliver the equipment out to the patient's home. Probably more than anything in the location, though, would be our CPAP and bi-level machines. And we have a respiratory therapist that is actually, setting patients up in our location, in our office.
So since you were saying about your warehouse, which is pretty local, it's in our service area.
Yeah.
So the delivery is normally within a day?
Oh, yeah. A lot of the equipment that we provide is same-day setup, especially when you're looking at home oxygen. Any of the equipment typically in this area is set up same day.
Okay. The other thing is, I'm trying to think of, what would you like people to know about your the store at the hospital?
Just that we're more of a retail setting. We've got a very nice storefront right next to the Ginkgo.
Okay.
So
right in front of Starbucks?
Yes, right in front of Starbucks. Yes, so it is easily accessible. But, there's a lot of people that come in with even questions so they don't know how to get something.
And you have staff that they can, if someone did have a question, they're more than welcome to come in and ask questions.
Definitely. And my staff, actually, we are trained to fit for diabetic shoes, compression garments, and mastectomy prosthesis and bras, which is something a lot of people don't know about. It is something that isn't provided anywhere local besides at our location.
Okay. So then if you're doing something through that, you also probably work with our oncology staff as well?
Yes, the breast center allows us to use one of their exam rooms to do a lot of our fittings, which is really nice.
So then people can understand that there's a lot of just different opportunities, as well as a very knowledgeable staff that they can visit. So that's great. And what would you like people to know once they, my office is downtown, so I very much try to promote downtown, even though right now. It's sketchy trying to so just dodge. Just remember to pay attention to the barrels to make sure you're not on the wrong side of the street, or you'll end up in a hole. So, but as well as there'll be contact information that they can call your office. But what else would you like them to know about that location that's downtown?
I think just to remember that, you know, we truly do live out our purpose, which is helping patients to sleep, breathe, and feel better. And back in 2016, Dasco was actually named the HME Company of the Year by HME News.
Well, that's great.
Which is a national award. And so we really pride ourselves in quality care and just making sure that patients are receiving utmost quality.
Well, we are very happy to have both Jill and Heather visit with us today, as well as explain the differences, and the community can learn about home medical equipment, as well as visit both of the locations. Thank you.
Thank you, Sherry.
Thank you for watching Reid Beside You, and see you next time.